Hygiene and Sanitation. Whereas personal hygiene is an important aspect of a healthy lifestyle, the term sanitation generally refers to public health and the prevention of disease. Sanitation includes using disinfectants in the treatment room and maintaining clean supplies and equipment. By understanding and using dependable sanitation practices, we protect ourselves and our clients by preventing the spread of pathogens. Pathogens are invisible, disease-causing microbes. Some bacteria are friendly flora that grow in deeper layers of normal human skin. Their presence helps prevent the growth of pathogens. Transient flora are potentially pathogenic bacteria that we pick up on the superficial layer of our skin. Massage therapists accumulate transient flora on our hands as we massage our clients. These bacteria are easily removed by using an alcohol-based hand sanitizer or washing with soap and water. Fingernails can harbor infectious agents. Be sure to trim your nails below the level of your fingertips. Maintaining short nails allows you to use your fingertips in your massage techniques and protects your clients from getting stabbed by a long nail. Also, avoid using nail polish. Latex polish breaks down in massage oil, and chip nail polish has been shown to foster the growth of bacteria. The Centers for Disease Control and Prevention defined universal precautions in 1987 as a set of guidelines designed to protect healthcare practitioners from transmission of blood-borne pathogens, particularly human immunodeficiency virus, HIV, also hepatitis B and other blood-borne pathogens such as hepatitis C. In 1996, the concept was renamed Standard Precautions and expanded to include other infectious agents, including droplet precautions for influenza, airborne isolation for pulmonary tuberculosis, and contact isolation for methicillin-resistant Staphylococcus aureus. Standard precautions calls for the use of protective barriers. Hospital-based massage therapists are required to wear gloves and gowns when working with patients who are on contact isolation. In any massage therapy setting, wear gloves if you need to touch a client's non-intact skin, or if the skin on your hands is not intact. For example, if your hands have cuts or abrasions. But if you have an infectious condition, avoid doing massage at all until the condition is resolved. When using gloves, avoid latex because latex is a potential allergen. Also, for massage therapy, latex gloves are inappropriate because oil, as well as oil-based creams and lotions, will compromise their integrity, causing latex gloves to leak and split. Non-latex gloves, such as synthetic rubber, nitrile, vinyl, or neoprene, provide acceptable barrier protection against viruses and other microorganisms. Change gloves after contact with each client. Wash your hands immediately after you remove your gloves. Bacteria evolved to develop enzymes and genes that defeat the mechanisms of antibiotic agents. These bacteria become resistant to the variety of drugs that had been developed to fight them. Examples of multi-drug resistant organisms include Clostridium difficile, C. diff, which causes diarrhea and can cause serious intestinal conditions such as colitis, drug-resistant tuberculosis, which has become a worldwide public health problem according to the World Health Organization, and methicillin-resistant Staphylococcus aureus, MRSA, which has evolved from a nosocomial condition, meaning a hospital-based condition, into a condition of the greater community. MRSA may first appear as a skin infection that looks like a pimple or a boil. It can become red, swollen, painful, and have pus or other discharge. Serious infections of MRSA can cause pneumonia or bloodstream infections. To avoid acquiring or transmitting MRSA, wash your hands frequently. In between washings, use an alcohol-based hand sanitizer. Keep cuts and scrapes clean and covered with a bandage until healed. Avoid contact with other people's wounds and bandages. And avoid sharing personal items such as towels and sheets. Rather than rigid rules and regulations, the Centers for Disease Control's guidelines for cleaning and storing linens are based on common sense sanitation practices. Bag or place soiled linen in containers and handle as little as possible to prevent the spread of pathogens. Economical bulk containers of oils, creams, and lotions need to be stored in cool temperatures and checked periodically for rancidity if not quickly used. Some nut oils, such as almond, become rancid in 6 months, and many creams and lotions are oil-based, so they will spoil in time, too. Generally, you can tell if a lubricant has gone rancid by its odor. Lubricants that wash out easily will prolong the life of your linens. Some massage therapists prefer massage creams that are too thick to use in pump bottles. Packaged in jars, these thick creams present a hygiene issue. You do not want to contaminate your cream by continually putting your hand into the jar to massage client after client. Use small paper cups that you can throw away and a butter knife to transfer the cream from the jar to the cup. Protect bulk products. There are 3 levels of antimicrobial agents: sanitizers, disinfectants, and sterilants. Sanitizers are low-level antimicrobial agents primarily used in non-food situations to reduce, but not necessarily eliminate, microorganisms to levels considered safe by public health regulations. Disinfectants eliminate infectious fungi, viruses, and bacteria. Disinfectants cannot destroy the spores of infectious agents, but can help maintain an unfavorable environment in which the spores will remain dormant. Hospital-grade disinfectants are registered by the Environmental Protection Agency, commonly used in healthcare facilities to disinfect floors, walls, countertops, and equipment. Hospital-grade disinfectants are effective in killing a wide range of bacteria, fungi, and viruses. Hospital-grade disinfectants are recommended for massage therapy environments. Sterilants are high-level antimicrobial agents. Sterilants are sporicidal. Sterilants are generally used in hospitals on medical and surgical instruments and equipment for infection control.